I will do my best to get us back on time. But yes, I am Dr. Kay. I'm a licensed clinical and organizational psychologist in the United States. And let's see if this is working. Sorry, it doesn't like Zoom. There we go. Okay. Anyway, so the Odyssey Approach took about 5 years of research and field work to create and perfect, and I'm excited to share it with you today. It's been thoroughly researched and thoughtfully designed. And what inspired this is that the medical delivery model has wonderful elements and it's produced incredible interventions. It's helped numerous individuals. Yet there remains endless others who need and want therapeutic care but are not receptive to the medical model or Eurocentric approach. And we see this consistently with our dropout rates, our therapeutic dropout rates. And the research shows that it's not only Indigenous populations that are struggling with the medical delivery model, but it's across age, ethnicity, socioeconomic status, geographic location. And these dropout rates of therapy continue to be the largest obstacles in care. And research shows this is most strongly linked to the therapeutic alliance. And so, as you may be familiar, across all approaches of therapeutic care, the relationship one has with their therapist is the strongest predictor to treatment outcomes. So, in other words, the most influential piece to care is the relationship with your therapist. So this is unique to the field of mental health because the medicine is the therapist. We are the pill, we are the serum, the elixir, if you will. So if a patient doesn't connect with their medical doctor, they can still heal by taking their medicine. But if a client doesn't connect with their therapist, that's it. So we must now turn to therapists and ask, why are you not working? Why aren't you doing your job? You're not being good medicine. You're not building these relationships with clients and they're leaving. Well, most therapists these days, at least in the US, they're burnt out. So underpaid, overworked, and treated as if they are the problem. And sometimes they believe that they are. So, clinicians adopting this self blaming mindset is unfortunately quite common, and research has taught us that there are various components in this cycle of imposterism. So, sufferers are occupied with self doubt, they fear that they cannot repeat their accomplishments, and they often dwell on past failures. And this can look like frequent worry, anxiety, fear around a project, event, or circumstance, and may result in either overworking or over preparing and even procrastination. And these fears of failure are associated with shame and humiliation that can lead to taking drastic measures in order to avoid making mistakes. This includes avoiding any new challenges, any situation in which there is a possibility of not excelling. So another component of the imposter cycle is the need to be special or the best. So this superwoman, superman, super being aspect results in the need to do everything perfectly with ease. But when one falls short of this standard, they tend to dismiss their very real talents. And this dismissal can go as far as denying one's competence, discounting praise, which cultivates an inability to accept compliments and becomes an acquired aversion to positive feedback. So, in most cases, therapists have sacrificed more than their time and money to become professional people helpers. They sacrifice their own well being and quality of life for their job. And it is a job to hold another's spirit. Making room for restoration and growth is an enormous responsibility, and it can weigh heavy and become burdensome when not properly practiced. It is the nature of the occupation to give one's time and full attention to the individual they are treating. And this requires an abundance of energy to actively block one's own natural cognitive and physical reactions to remain entirely engaged on the others that surround them. And this is not just for one client or patient, This process is repeated for numerous humans multiple times a week, and then the therapist, who is also a human, must continue to give their time, attention, and energy to the people in their personal life. And an overwhelming number of therapists experience burnout and even compassion fatigue. So, burnout results from prolonged exposure to demanding interpersonal and emotional stressors, which is an occupational hazard in our field. And compassion fatigue surpasses simple burnout. It is a condition that mirrors post-traumatic stress and is the result of exposure to knowledge about traumatizing events of others. Burnout and compassion fatigue, they lead to negative cognitive and behavioral changes, and that's been found to be a causal link to depression and substance use disorders amongst providers. So some of you here may be at risk of experiencing burnout, or you already have a relationship with it. And here today, I'm sure I'm surrounded by many therapists who are at an increased risk of severe burnout because they're a high-functioning, high-achieving professional women, the population of therapists who are at the highest risk. So when it comes to rates of client dropout and provider burnout, there are plenty of tips and tricks out there that can be very helpful. But today I'm going to talk about one, and that is the Odyssey Approach, because it cares for both the client and the therapist. Due to the length that I have time to talk, I am going to focus mostly on the client portion, but I will touch on the small research on the therapist's effects as well. So the purpose of the Odyssey Approach is to help others achieve their quality of life goals in a new way and to reach individuals who do not resonate with the current mental and behavioral health services. So this therapy model is designed as an overall lifestyle that emphasizes one's choice to live as their desired self. And the design of the Odyssey Approach was originally intended for the care of indigenous cultures, specifically influenced by the Maria Atua approach to well-being, which is centered on Maori culture. So as influenced by Maria Atua, the deep work of the Odyssey Approach involves reviewing one's past through storytelling to identify one's core design. I'm going to be using some different terminology, so I've popped it up there. But the idea of the Odyssey Approach is to make things less clinical, less hyper-manualized. So that's why we have this flowery language instead. So one's core design or central narrative is the root of their cognitive distortions, which is used to inform their future, right? So this experience can be difficult for many, which is why using Maori creation stories, Hindu lore, and other powerful tales are used in the Odyssey Approach to assist in self-reflection through relation. At times, following another's story can facilitate introspection by allowing the mind to take a stroll away from the self, gaining enough distance to look back and see something it was too close to see before. So the Odyssey Approach prioritizes human connection through the therapeutic alliance and emphasizes the imagination by assisting the client or voyager in idealizing and envisioning their life as a glorious adventure, an odyssey. So to encourage this active engagement with life and the self, the voyager is given custom curated materials by their therapist or guide to assist them in their personal odyssey into wellness. So such materials include a personalized star constellation developed from a battery of evidence-based assessments in personality, love language, and attachment style, a compass to represent the core tenets of the voyager's driving narrative, a map to illustrate the complexity of their life journey. And the star constellation is a symbol tied to the voyager's constellation, which is just the new word for case conceptualization. And so it's the most important piece to start the Voyager guide relationship. But let's go into the structure of the Odyssey Approach before we dive into those details. So the Odyssey Approach consists of two pillars, prioritizing human connection and utilizing imagination. And this is grounded in psychodynamic, humanistic, and cognitive behavioral theories. And the model draws on storytelling as the unifying thread connecting these pillars, since it seamlessly blends human connection and imagination. We've already established that the importance of the therapeutic relationship, but there's also understood from extensive cognitive behavioral research that our beliefs can change our actions. First, we need awareness that change is an option, and then we need motivation to change and the tools to make that change. Finally, we can change, improving our life by changing our belief about the self and the self in our own world. Belief about the self increases motivation to be different, and therefore increases divergent thinking, including imagination. Imagination is a powerful tool, and research also shows that routinely reading and visualizing personalized positive phrases about your competence, physical attractiveness, and social abilities can enhance those dimensions of self-esteem. So utilizing the imagination in this positive way and applying it directly to autobiographical memories simultaneously stimulates and reinforces existing connections between the self and positive beliefs about the self. And so this results in increased positive self-perception and episodic and semantic memory retrieval. So in a way, it's rewriting your story, or at least it's seeing it through a different lens. Okay. So within the first session, the guide conducts a clinical interview, collecting information about each aspect of the Voyager's life, including current and historical influences of biological, psychological, and social elements. This clinical interview should be extensive to the Voyager's whole life, including influences of culture, spirituality, socioeconomic status, and context of support and traumas in their life. So collecting the dynamics of the Voyager's life is crucial to the formation of the case conceptualization and ultimately the core design, those schemas. The case conceptualization is represented in a curated star constellation, which is really just data visualization, but it's a bit more personalized and interesting than just handing your client a graph. So I've come up with this. And so the star constellation results from a careful blend of assessments targeting the Voyager's personality, attachment style, and love language. So you're seeing different client constellations, and it's all data points based on that battery of assessments. And so that's how we start. And then we get introduced to the map. This is a visual representation of the Voyager's life domains in the form of islands. So we've got our social island and our health. We've got our trade. And of course, we have our spirit. So simplicity of these life domain categories is intended to be inclusive and allow the Voyager to apply their unique perspective to how they function. So the map may change over time. So the Voyager may see something new every time that they look at it, new features, and assign those features to something important to them. And it's important to note that the light and dark map will always coexist, just as the astral and veiled self will always coexist. So the map is not right versus wrong. It is more of a cyclical struggling driven by the harrowing of one's past. It's our dark map. Versus our active goal seeking towards our future. Okay. So belief about the self is layered and fluctuating, which is why defining these layers in broad terms is helpful in long-term utilization. So in the Odyssey approach, these layers are categorized as astral and veiled self, which coexist within the self. And the leading self is the present, active, conscious layer of the current self. The astral self refers to the self that exists on the light map, the goal self of the individual. The veiled self refers to the self that exists on the dark map, the struggling self of the individual. And the leading self just refers to whichever self is active, either astral or veiled. And so the self is made up of astral and veiled self because they both form the self. It is a strength to bring awareness to the veiled self. accept the veiled self and choose the astral self, and it helps the Voyager grow. We don't want to rid of the veiled self or suppress it, because that's an act of self-rejection. By acknowledging the veiled self, right, acknowledging our struggles, the Voyager is engaging in mindfulness, self-acceptance, self-compassion, learning from our mistakes, and this is what gives room to the astral self. Next, we've got our compass. This starts with the Voyager's core design, which is the underlying need or unconscious core schema that drives the Voyager's cognitions and behaviors. And so I like to use I am enough, I am not enough, I am enough, light map, I am not enough, dark map. And it'll make a little bit more sense. So let's get into it. A Voyager's north is their reactionary need that stems from their core design. So on the light map, this is an adaptive need, and on the dark map, this is a maladaptive need. The Voyager experiences a drive to fulfill a need, which leads them to their east. This refers to evidence to support their need. The Voyager may seek out new evidence or refer to previously collected evidence to fulfill the need. This cognitive behavioral engagement is a compulsion to balance the mind and correct the dissonance. So evidence on the dark map supports the maladaptive need. Evidence on the light map supports the adaptive need. The Voyager's south refers to their strengths, and this remains constant across maps. Strengths consist of positive personal facts that exist beyond context. When referenced on the dark map, strengths prevent spiraling thoughts by grounding the Voyager to their self. When referenced on the light map, strengths pair positive evidence and active engagement with their adaptive need to the self. So in other words, referencing strengths on the dark map prevents further maladaptive engagement of the self. Referencing strengths on the light map enhances adaptive engagement of the self. And then we come to the Voyager's west, which refers to why their need was activated. By bringing awareness to the antecedent of the cognitive behavioral cycle, the Voyager can make a choice to then travel to their light map and engage with life as their astral self. That west point also brings awareness to communication, boundary, somatic obstacles that the Voyager may struggle with in addition to their cognitive behavioral cycle. And the last piece is storytelling, which has a powerful influence on increasing self-esteem and therapeutic relationship, which is why it is essential to the Odyssey approach. As previously mentioned, Maria Atua serves as a very strong influence for the intentions of the Odyssey approach, since individuals benefit from engaging in therapeutic storytelling of myths, legends, and tales. And this experience helps in processing one's events, reactions, and emotions, and provides motivation for new behaviors. Therapeutic storytelling, or just storytelling, is a transformative experience, inviting Voyagers to bring their own meaning and significance to the narrative. Storytelling consists of well-structured metaphors and metaphoric narratives that capture the listener's attention, inspiring imagination and purpose, and so they can propose new considerations for situations. A story's message is disguised by imagery, which presents the opportunity for a less threatening exchange between guide and Voyager than if a guide were to directly advise the Voyager. It is crucial for the Voyager to experience the realizations on their own through self-determination, because it fosters the freedom to choose one's own process of change in one's own time. In other words, the Voyager assigns the meaning to the narrative as it relates to their journey in a way that grants them autonomy and empowerment in their healing. So the Odyssey approach focuses on those Maori creation stories, Hindu lore, and other tales to share in early developments of human storytelling and highlight concepts and contexts as normative to the human experience. So for instance, in Hindu lore, there are numerous queer stories of pregnant kings, women who become men, and men who become women, which illustrates the power and fluidity of male and female sexuality and identity. And we take the Maori narrative of how heaven and earth were separated from each other by their own kin, which ruminates in the complexity of love and life. It's encouraged that guides read these stories and retell them to their voyagers as they apply to the voyagers' experiences without explaining the direct connection. The nature of the guide-voyager relationship should be based on an exchange of experience, learning, and wisdom. And guides should encourage their voyagers to read and reread stories from their own autobiographical story or from a favorite book from their past. In these exercises of rereading, the voyager is invited to dissect elements from the narrative. So by combing through the content in search for meaning, the voyager may acquire a new perspective of the message and identify themes that relate to their recent stories or life events. From storytelling, the subsequent reflection processes trust, and it cultivates a connection in that therapeutic relationship, which brings us all the way back to the beginning, which is this huge issue leading to burnout and dropout rates. So very quickly, I conducted a private practice pilot study and evaluated the clinical efficacy of the Odyssey approach in improving self-esteem among young adults and reducing burnout in clinicians. 5-week pilot study was conducted with a small sample, just 25 clients and 5 licensed clinicians. Ages of the clients was 18 to 25, and the clinicians were trained in the Odyssey approach. So clients participated in weekly 60-minute individual sessions using Odyssey tools that we just went over, including that star constellation, compass, and map. And the standardized self-report measures were administered pre and post-intervention. So the Rosenberg self-esteem, the RSES for clients, and the Malik burnout inventory MBI for clinicians. Okay, so quantitative analysis revealed a statistically significant increase in client self-esteem, in which the mean self-esteem score increased at a very significant level. And the results show a significant increase between week 1 and week 2, week 2 and week 3, week 3 and week 4, and week 3 and week 5, suggesting that client self-esteem was increasing steadily with each Odyssey session. Further, 4 weeks after discharge, self-esteem scores remained statistically unchanged. Clinician burnout scores decreased across the 3 MBI subscales, with emotional exhaustion showing the most improvement, such that the mean score was reduced also significantly. This qualitative feedback suggested that these narrative-based tools promoted deeper therapeutic engagement and emotional resonance for both clients and clinicians. The Odyssey approach demonstrates promise as an innovative therapeutic model that not only improves psychological outcomes for young adults, but also supports clinician well-being. So by incorporating storytelling, autonomy, and personalized tools, the model may serve populations underserved by traditional hyper-manualized therapy, but clearly, larger research samples, more diverse research samples is warranted. Okay, I hope I got us on track again. So thank you for your attention. Please reach out to me if you are curious about any more information. There is my website and you can contact me there and also read more about it. But I will leave you with a Maori proverb, my favorite, which is, "We walk backward into the future." So thank you.